If you're a woman in your late 30s, 40s, or even 50s, and you're dealing with pain, stiffness in your low back, doesn't matter what you do, you stretch, you strengthen your abs, then this video is for you. Hint, the issue is not about strengthening your abs. It's about something deeper, literally. My name is Jennifer Schwomeyer. I am a physical therapist and nutrition health coach, and I specialize in helping women in midlife move better, feel stronger, and take control of their health. After working with many women in their 40s and 50s, I kept seeing the same thing: back pain and stiffness that would just not go away, even with stretching and core work. And that's what inspired me to do this video. It's not that the core is weak, it's that the deep support system that most of us never learned about is out of sync. So that is what I want to talk about with you today. So what is happening? As we go through perimenopause and menopause, as we get older, our hormones shift. We have less estrogen. This affects our joint stability, our tissue elasticity, and our ligaments. We tend to lose lean muscle mass when we go through perimenopause and menopause. So this decreases our strength, but this can also affect our muscle timing and coordination. Combine this with increased stress, difficulty with sleeping, and sitting more, and you tend to see nervous system dysregulation and postural changes. Most people understand that we have a core, the foundation of all of our movement, but we also have a deep core. The deep core is very important to turn on before certain movements to help provide stability to our bodies. So these muscles include our transverse abdominis, our diaphragm, our multifidus, and our pelvic floor. And these muscles are supposed to stabilize before we move. So if I think about opening a door and turning a doorknob, before I actually make that movement to go open the door, my deep core should be turning on. The problem is there is often a disconnection where these muscles do not fire when they're supposed to, and we tend to lose stability. So what we often see with a disconnected core might be diastasis recti, where you have separation of the rectus abdominal muscles, pelvic floor tension or pelvic floor weakness. We see shallow breathing or upper chest breathing, or even dysregulated intra-abdominal pressure. This might mean bracing or holding your breath when you go to lift something. So if I demonstrate the stability of the deep core and how important each piece is to providing stability to your body, to your skeleton. Let's say we have a full can and it is under appropriate pressure, it has air in it, it hasn't been opened, right? But then when we open the can and let's say we dent one part of it, you can see how it is no longer supported. So let's say the diaphragm isn't engaging properly, or perhaps the pelvic floor underneath is not engaging properly. You can see where it does not have the best support and it loses its stability. Another way to show this would be, even if you do have a six-pack, you might not have proper deep core activation. An example would be in a bird dog, right? So if you're in a bird dog position and you don't have proper activation of the deep core, you're going to tend to be wobbly, you're going to tend to arch in your low back, and you're not going to have the stability to do the bird dog properly. So we're going to go through a few techniques to help you learn how to engage the pelvic floor in the best way. So the first exercise we are going to do is diaphragmatic breathing, or you can call it 360-degree breathing. I'm going to use a yoga block in between my legs to help engage the groin muscles or adductors, which also helps engage the pelvic floor. You're going to lay on your back. You can put your hands just around your rib area to kind of help you, give you cueing to expand your ribs as you inhale. So first thing we're going to do is inhale and think about pressing your abdominals and expanding your stomach into your fingers, and even all the way down into your pelvis when you inhale. So go ahead and do that. And then you're going to exhale. And this is where you're going to zip up your deep core, your transverse abdominis. You can think about pulling your belly button in as if you're pulling in a tight pair of pants. You can think about pulling your pelvic floor up, almost like an elevator that's rising up toward your belly button. And you're going to pull in as you exhale. I've also heard of people say it's as if you're picking up a blueberry. You could try that, or engaging your sit bones by pulling your sit bones together. All options to try to figure out how to engage that pelvic floor. So I want you to cycle through this a few times. So you're going to inhale, again, expanding your stomach. Think of a balloon, and you're expanding back and front in 360 degrees, pushing out against your fingers. And then exhale, pull everything in, engaging your transverse abdominis, your pelvic floor, thinking about that elevator rising up, and then inhale and exhale. And inhale. And exhale. So when you exhale, you can think about pressing into the yoga block to help engage those groin muscles, and then just relax when you're inhaling. The next exercise we are going to do is dead bugs. And this is a great exercise to practice your breathing, practice your exhalation with your pelvic floor engagement. And then when you're inhaling, you really want to think about using the diaphragm and pressing out into your fingers. So let's go ahead and try it. You're going to lay down on your back. You're going to lift your legs up 90 degrees, and you're going to have your hands just straight up in front of you. And what you're going to do is exhale as you lower opposite arm and opposite leg, and then inhale as you come neutral. So exhale and inhale. And really think about, as you lower your arm and leg, that you're pulling in that pelvic floor and you're engaging that transverse abdominis. You really want to go slow with these. You can cycle through that about 10 times or so, really slowing down and thinking about cycling through those breaths. The next exercise I really like because it really gives you that cueing to exhale as you are pulling your legs up is the bear. And I'm going to actually, again, use a block. So I'm going to think about squeezing against the block as I'm exhaling and then inhaling when I come back to neutral. So let me show you what that looks like. So I'm putting the block in between my knees here, and then I'm going to be in a quadruped position. And then you're going to think about exhaling as you lift your knees up, and then inhaling as you come back down. So you're going to rest your knees down on the floor as you're inhaling, and then you're just going to lift your knees up and think about engaging that pelvic floor, the transverse abdominis, as you are exhaling. So let's try that a few times. So here we go. Squeezing that block and then lowering down and inhaling. Really try to keep your back in a neutral position. Don't let it sag. Okay, here we go again. And one more time. So I'm always thinking about the glutes. A lot of us need some help with turning our glutes on. So we're going to do one final exercise where we engage the glutes. It is a bridge. You can make this harder by doing single leg bridge. Double leg bridge is going to be easier. You're going to lay down on your back. Again, you can use a yoga block or a pillow to help, again, engage those groin muscles that are deeply connected with our pelvic floor. So here we go. When you lift, you are going to exhale, and then when you lower, you will inhale. So go ahead and lift up and lower down as you inhale. Or to try one leg, you're going to kick one leg up and lower. You can alternate sides. The key with all of these movements is learning and becoming more aware of engaging the deep core. So practice these moves even if you're standing around. Maybe you have to do a couple of squats because you have to pick up laundry. You could practice lifting a laundry basket and engaging the deep core, exhaling as you lift the laundry up. So there's a lot of real world functional types of moves that you really want to try to learn to engage the deep core as you do these. And that is going to help you learn to engage the deep core more often and help with that timing with real world activities. Remember, your core is not broken, it is just out of sync. Learning how to rebuild the connection between your pelvic floor, your breath, and your movement will be the game changer you're looking for. If this connected with you and you are tired of feeling stiff, in pain, or like your body just isn't moving the way it used to, know that it is not just aging and you do not have to settle. And this is exactly why I am working with women with physical therapy and health coaching to help improve and restore strength, mobility, and confidence in your body. So be sure to stay connected and subscribe to my channel as I continue to provide more videos to help you feel stronger, move better, and take back control of your health.